Hello friends, I am Dr. Rahul Podar. I practice at Podar Nursing Home at Ghaziabad. I am a general and laparoscopic surgeon, a colorectal surgeon and a minimal access surgeon. I have been practicing in Ghaziabad for last 10 years. We are here to discuss a common problem of patient-doctor relationship. Often patients are hesitant how to discuss their problems with the doctor. Especially this relationship needs a very depth, a very trust between the two, and in such a short period it becomes very difficult to attain this. And so our aim of our today's discussion is to make this a little easier. The first thing that we need to understand is the aim of our discussion is to make it clear to the patients how to approach their doctor, how to ask from the doctor about their queries, things they should ask, and how to make their treatment more effective, better and less painful, and how to improve the outcomes. Often patients' understanding makes this part a lot variable. The more better the understanding between a doctor and the patient, the better is the outcome of the disease, the better the patient cope up with the problem, the better is the result of the same treatment between one patient to other patient. It varies just because of one simple factor. The doctor has to do his role, but the patient also has a very big role. Often this role is undermined and ignored. People come to a hospital and they want doctors to treat them, but this is often not understood in the society that patient has got a very important role in their own treatment. So to start with, first, a person who has to undergo a treatment, the moment he realizes that he has some problem, he has some disease, he visits a doctor. From that moment the treatment starts from the patient side and from the doctor's side. And the patient, the more important part is actually from the patient side, and his treatment does vary just because how much he understands his disease and the treatment part. Or if any surgical procedure is required, that becomes even more serious. His understanding is even more required in that case. So the first part is to understand what disease he is having, what organ is affected, and what are the consequences of the disease itself, how the disease will affect his body. And for this, although it requires a lot of courage and often it gives depression, it gives anxiety to patient, but this is an inevitable part of the life, and once it has happened, it has to be accepted. And to start with, the first thing the patient should discuss with his doctor is about his disease. Often patients do not ask what is the disease, they just ask what is the treatment. They just want a prescription, they just want some tablets to be prescribed and they want to be fine after that. This is not how the treatment goes. First you have to understand that you have a disease and there are consequences, and you have to understand them with all the required courage, with all the required trust in the doctor. Now, understanding the points that are to be asked to a doctor, first thing that you have to ask what disease you have, what organs that are affected, and what are the consequences. This we have already discussed. Then you should understand what is the prognosis of the disease. Prognosis means how the disease progress, how the disease affects the life, what will be the quality of life, how much life is expected after the disease, and is the disease completely curable, or it's partially curable, or it is not curable. The second thing, that after you understand the disease, you should try to understand what treatment can make it better, what treatment can recover you from the disease. Now that recovery can be complete or incomplete or partial. Whatever the maximum possible recovery is possible with various treatment options. Treatment options can vary from medical treatment, surgical treatment, paramedical modalities are there, diagnostic modalities which help in gaining the information about the disease and planning the treatment. Often patients approach me as considering that approaching a surgeon means getting a surgery. This is not true. Approaching a surgeon can also mean undergoing a medical treatment or undergoing a surgical treatment. Now, often most of the disease have many options. It's not like one disease, one treatment. It may have a medical treatment option, it may have a watchful expectancy treatment, or it may have a surgical treatment. Even the surgical treatment have various options, a more radical form, a more conservative form, and sometimes even the anesthesia varies. Same procedure can be done in different anesthesias, and different anesthesias have different risks. So all these things have to be decided, and for this decision to be taken, the responsibility lies both on doctor and the patient, and often this responsibility is left on doctor. But this makes the treatment very difficult for the doctor because it increases the responsibility to a great extent, and if the patient shares this responsibility, the treatment becomes much better. If the patient understands what treatment he has to undergo and what options he has, and all the effects or all the benefits and the risks of those options, all the complications, each has a different complications, and there is no treatment which is 100% successful or 100% guaranteed that there won't be any complication. Even a simple injection can lead to death in the greatest of the hospitals of the world. So coming to the last part of today's discussion, the next and the last part is that a patient should understand what precautions or what changes in the lifestyle he will have to undergo if he undergoes a certain treatment or some other treatment, or if he doesn't undergo any treatment. And he should understand what is the goal of the treatment. Often the goal may be to recover from the disease, or goal may be for a partial recovery, and a goal may be just to prevent further complications, and sometimes the goal is just to make a diagnosis. So the goal has to be understood. Every treatment or every procedure has its goal and has its limitations. And the next thing that he should understand, that what precautions or changes in the lifestyle will happen after treatment. And often the treatment is in multiple parts. It's not like one part is over, and to complete the treatment he may undergo in another part of the treatment. Like for cancer, if surgery is done, often chemotherapy or radiotherapy are required, and if for different surgeries for the same cancer, different follow-up treatment modality is often planned. That would depend upon the primary treatment, and so a patient has to be ready for all these changes in his lifestyle that will happen forever, often forever. So don't hesitate in sharing your personal history. Don't hesitate in asking any query, and make your treatment most effective. Best of luck.